Hi, my name is Sofia Correa, and today I'm going to talk to you about Tiotropium Respimat inhaler and the risk of death in COPD. We're going to start with the definitions. First, what is COPD? COPD is the name for a collection of lung diseases including chronic bronchitis, emphysema, and chronic obstructive airway disease. COPD stands for chronic obstructive pulmonary disease. A video about COPD.
Chronic obstructive pulmonary disease kills over 100,000 Americans each year, making it the fourth leading cause of death in the United States. So what exactly is chronic obstructive pulmonary disease?
Actually, chronic obstructive pulmonary disease, or COPD, refers to two different diseases of the lung, emphysema and chronic bronchitis. Since emphysema and chronic bronchitis are each usually caused by years of cigarette smoking, afflicted individuals are almost always diagnosed with both at once. Hence the umbrella term chronic obstructive pulmonary disease. This combination of diseases can also be caused by years of inhaling a variety of industrial toxins, fumes, and chemicals. Prolonged exposure to air pollution and secondhand smoke, or even a history of childhood lung infections, can also lead to COPD. However, since chronic bronchitis and emphysema affect two different parts of the lung, let's take a separate look at each of these diseases. Chronic bronchitis is characterized by an inflammation of the bronchial tubes, which are passageways that branch off from the trachea or windpipe and allow air to enter the lungs. This inflammation causes thick mucus to build up in the tubes, preventing sufficient air from reaching the lungs. Emphysema occurs when the walls between the air sacs in the lungs, known as alveoli, lose their elasticity. This, in turn, causes the air sacs to become fragile and overinflated, leading to an unnatural retention of air within the lungs. The symptoms of COPD tend to depend on which disease is more prominent in an inflicted individual. If emphysema is the predominant disease, the first notable symptom will be a shortness of breath during physical exertion. This will soon be followed by a phlegmatic cough and pursed lip breathing. If chronic bronchitis predominates, a persistent mucus-filled cough will often be the first symptom to appear. This may be accompanied by wheezing, shortness of breath, fatigue, and respiratory or lung infections. COPD is usually diagnosed based on an individual's medical history and an examination of his or her lungs. This lung examination can be done with chest x-rays, CAT scans, and any number of pulmonary function tests such as spirometry.
Okay, so now we're going to define the drug, which is the tiotropium. Tiotropium is used for maintenance treatment of chronic obstructive pulmonary disease, which includes the two different diseases that it was already said, which are the bronchitis and emphysema. It is not, however, used for acute exacerbations. Applications in medicine. Now, this is a study that the New England Journal of Medicine did, in which the method consisted of the evaluation of the safety and efficacy of the Tiotropium Respimat at once daily dose of 2.5 micrograms and 5 micrograms, as compared with the Tiotropium HandiHaler at once daily dose of 18 micrograms. The HandiHaler is the regular inhaler that people with COPD use, and this is a video that shows you how to use it.
But also a different type of inhaler. Spiriva's HandiHaler contains an instrument that pierces the capsule and releases the powder, while most other inhalers have a twisted brake method of releasing the powder. The HandiHaler is simple and easy to use. First, lift the dust cap by pressing the green button and pulling the dust cap gently upwards. Open the mouthpiece. Second, remove a capsule from its packaging. Insert the capsule into the center of the device. Close the mouthpiece until you hear a click. Hold the HandiHaler
It's 12:45
upright and press the green button. This button pierces the capsule and releases the powder inside. Do not press the button more than one time. Close your lips over the mouthpiece. Breathe in slowly and deeply. If the capsule is vibrating and you can feel it, then you are breathing correctly. Hold your breath and remove the HandiHaler from your mouth. Once you have held your breath for more than 5 seconds, begin breathing at a normal rate again. Once you have finished, discard the capsule and close the HandiHaler until its next use. Clean the HandiHaler once per month. Do not keep used or unused capsules.
Okay, so that was the way of how to use a HandiHaler. Continuing, once they did the method and they figured out how they were going to do everything, they came with the results, in which they found that the Respimat was not inferior to the HandiHaler with respect to the risk of death and not superior to the HandiHaler with respect to the risk of first exacerbation. The causes of death and the incidences of major cardiovascular were similar in the 3 different groups that these people did. Once they had the results, they came up with the conclusion, in which the Tiotropium Respimat at a dose of 5 micrograms or 2.5 micrograms had a safety profile and exacerbation efficacy similar to those of the Tiotropium HandiHaler at a dose of 18 micrograms in patients with COPD. What are the advantages of this drug? Now, the tiotropium is effective for lung problems since it works by relaxing the muscles around the airways so that they open up and you can breathe more easily. And as every drug, it has side effects. So the disadvantages of the tiotropium is that most frequently it causes dry mouth or throat irritation, and rarely it causes urinary retention, constipation, acute angle glaucoma, palpitations, and allergic reactions. On related disease, we have asthma. Asthma is a disorder that causes the airways of the lung to swell and narrow, leading to wheezing, shortness of breath, chest tightness, and coughing.
More than 20 million Americans suffer from the condition known as asthma. But what exactly is this disease?
Asthma is a chronic respiratory condition in which a person's airways become narrowed, making it difficult to breathe. There is currently no cure for this disease. Asthma is typically characterized by coughing, wheezing, and shortness of breath. When allergens or environmental factors cause a spike in these symptoms, it is known as an asthma attack. During an asthma attack, the large airways, called bronchi, react to a trigger like an allergen with contracting spasms. The bronchi inflame and produce mucus, further narrowing the airways and leading to the symptoms of asthma. Attacks may last just a few minutes or can linger over several days. Symptoms can usually be relieved using asthma medications, but may also dissipate naturally in mild attacks. Asthma is not new. In fact, it made its first appearance in the Iliad, where the poet and author Homer coined the term from the Greek word for sharp breath. Centuries later, in 450 BC, the philosopher Hippocrates used the term to describe breathing difficulties and spasms that he had observed in tailors, anglers, and metalworkers. Today, doctors agree that there is a strong genetic component to asthma. However, it takes more than genetics to make a person have an attack.
So, now continuing with the treatment. The most effective way to treat asthma is by identifying what triggers the asthma attack. It can be things such as the cigarette smoke. If you're around someone that smokes, you can have an asthma attack. It can be if you have pets, such as dogs or cats. People are sometimes allergic to this type of animals. And it can be also drugs, such as aspirins. And the way to avoid having an asthma attack is by eliminating the exposure to the trigger. There are also some drugs that are called bronchodilators, which are highly recommended for short-term reliefs of the symptoms. There's something important that you have to know is that currently there's no cure for asthma, but you can treat the symptoms that it causes.
Just because you have asthma doesn't mean you need to sit on the sidelines. With proper treatment, asthmatics can lead normal, active lives.
Asthma is a chronic respiratory condition which currently has no cure, but an allergist or pulmonologist can help you create a specialized treatment plan to help keep your symptoms under control. During an asthma attack, the large airways, called bronchi, react to a trigger like an allergen with contracting spasms. The bronchi inflame and produce mucus, further narrowing the airways and leading to the symptoms of asthma. The goal of asthma treatment is to eliminate symptoms and reduce the frequency of asthma attacks. Treatment plans typically include three components: medication, environmental management, and monitoring. Medication works by reducing inflammation, which opens up the bronchial tubes, allowing air to flow easily through them. One type that is inhaled directly into the lungs through use of an inhaler is rescue medication. It relaxes bronchial tubes, improves airflow, and is used during an asthma attack to alleviate symptoms in the short term. Long-term control medications like Arabid are also inhaled. These corticosteroids work around the clock to relax bronchial tubes and suppress reactions to asthma triggers. In this way, corticosteroids can help prevent an attack or limit its intensity.
That was it. Thank you.